Nicole, Conversations with Nicole. Let's talk about it. Tell me all about it. I'm here. I wanna know what's on your mind. Ooh, the world needs to hear from you, and I'm so glad to have a conversation to reach the nation. And it's all about you. We'll help each other to discover innovative ways to positively change the world. Let's talk about, let's talk about, yeah, let's talk about conversations with Nicole.
Greetings. Happy Monday. Welcome to Conversations with Nicole. I am Nicole Everett, your host. Conversations with Nicole is a talk show based in Tallahassee, Florida, focused on connecting the community through conversations. And today is what I call Mindset Monday. Mindset Monday is an opportunity for you and me and my guests to talk about whatever we want to talk about. And today's topic is cultural competency in counseling. Cultural competency in counseling. So we are live on Facebook, on YouTube, and on the Greater Works Network. So please tell your friends they need to log on right now because we are going to have a great conversation. This is an interactive live talk, and so we absolutely expect to hear from you with your comments and your questions. So before I read my guest bio and introduce you to her, I want to hear from you. So please, if you will, in the comments, let us know where you are tuning in from. Put your city in your state in the comments, and we'll give you a shout out. So cultural competency. As you all are logging in, what do you think cultural competency is? It's kind of a, maybe a funny phrase or slogan, and I've actually had a talk around this before, but it's definitely worth repeating and talking about some more. So, cultural competency, after you tell us where you're logging in from, let us know. What do you think cultural competency is? While y'all are doing that, I'm going to go ahead and introduce my guest, Miss Satara Carr. She is based in Jacksonville, but just found out that she is from Bainbridge, Georgia, so right down the road from Tallahassee. She is the owner of Blissful Wellness Counseling, a licensed mental health counselor who received her Bachelor's of Arts degree from Savannah State University and her master's degree in clinical mental health counseling from Webster University, the Jacksonville campus. And she is completing her doctoral studies at California Southern University. She began working as a mental health therapist at a community behavioral health clinic in Orange Park, and since then has gained additional experience working as a clinical director at a dual diagnosis residential substance abuse treatment facility. She has worked around the areas of eating disorder, and she is the owner of her own practice, like I said, Blissful Wellness Counseling. I love that name. So she opened that in 2019, and she works with adolescents and adults. And she's taken her years of experience and developed a combination of psychoeducation, skill building, and mind body focus as a way of helping her clients rebuild their lives. Satara's therapeutic style is client centered, emotion focused, and geared towards treating the whole person, mind, body, and spirit. So, help me welcome Miss Satara Carr. Yay!
Hi. Thank you, Nicole.
My pleasure. Welcome. So glad to have you here.
It's a pleasure to be here.
Indeed. So let me give a shout out to some of the folks that are chiming in. This is my godmom in Miami, Miss Corliss. We got, My sister Sheila, she's right here in Tallahassee. Thank you for being here. Ozzy from Virginia Beach. Ozzy is also a clinician, so thank you for being here. Cultural intelligence, Ozzy says. And then my mom is in Miami. She is chiming in as well. So a lot of great support here tonight. So before we get started, in terms of jumping into our topic, hey, Miss Lisa, I see you. And Renee, too. Okay, good deal. So Tallahassee is represented tonight. Before we get started with our topic, tell the people who is Satara Carr. Not what you do, because I just read that, but who is Satara Carr?
Oh, wow. That is like a mouthful because as a therapist, I'm trained to not really talk about myself as much, but in a word, if I could say something about myself, ultimately, I'm a mom. I'm a business owner. I'm a friend. I'm fun, easygoing, very laid back person. I'm just looking to do my part in my community, which is how I got into counseling in the first place.
Okay, good. That's great. That's great. So yeah, let's talk about that. How'd you get started in counseling?
Okay, nice little segue.
Nice little segue.
Well, to be honest, I think I've told you this before, Nicole, but I was originally a student of broadcast journalism. It was always my goal to get into journalism. I wanted to do the news and I wanted to be on the news. And around the time when Hurricane Katrina happened, I was working with the Department of Children and Families, and I had the pleasure of helping a family who was displaced during Hurricane Katrina. And throughout that process, I learned a lot about myself. And I knew right away, okay, this is what I want to do. I want to be in the position to help families. I want to be in the position to help them, move from, hardships to discovery. So that's how I essentially changed my major my senior year of high school. I know my mom is watching and she knows this. She was very upset with me. But I dropped out of school my senior year of college, switched majors, and became a counselor.
Wow. Wow. Okay, very good. And then the name Blissful Wellness. Talk to me about that. What's the inspiration behind that?
Well, blissful wellness. So, a lot of people, especially myself, when I talk about counseling and therapy, and when I would hear about it, it always sounded so daunting, like a task that you did not want to have to do, but you knew at some point you probably would. And so I said to myself, you know what? When people hear my name, I wanted it to be synonymous with hope. I wanted it to be synonymous with something that says, okay, I can get started. I can do hard things. I can do this, right? And so I said, what's a word that kind of makes me feel hopeful? And I thought blissful.
Okay.
Blissful, equates to happy and hope. And so I said, okay, blissful wellness, because that's ultimately the goal, right? Whole wellness of the whole self. And
Right.
so I said, okay, blissful wellness. And then counseling, you throw that in there to let them know that it's not, a lose weight, get fit quick scheme. It's a counseling. So
You're right, right. Okay, good deal, good deal. Well, I know you started this business in 2019, right?
I did.
Okay. And you are currently taking new patients.
I am.
All right. And you can serve all of Florida.
I can. I'm licensed to serve all of Florida. Yes, ma'am.
Okay. And you do telehealth.
I do. Primarily, that is the showstopper for me right now. Everyone from all over Florida is using telehealth with me.
That's all right. Okay. Very good. Very good. So just want to put that out there before we
Mhm.
get started, and we'll circle back before we close out today. But
Um,
before we jump into our topic, I have to read my disclaimer because we don't want anybody to mistake this show for counseling. All right. So all topics, past, present, and future, on Conversations with Nicole are for informational purposes only. They are not to be used as a diagnosis, for treatment, or an answer to any personal issues related to the topic being discussed before, after, or during the program. All right. So there it is. All right. So let's dive in. Let's dive in. And let me give a couple of shout outs real quick. I see you, Terrence Barber and Miss Deborah Lloyd, both here in Tallahassee. Thank y'all for tuning in. So let's dive in. Cultural competency. Cultural competency. So when I go to Google right? Google knows everything, right? Google tells me that cultural competency, loosely defined, is the ability to understand, appreciate, and interact with people from cultures or belief systems different from our own, right? Okay. All right. So, why is that important as it relates to counseling?
Oh, wow. So, first of all, we have to understand that you're treating the whole person. So, in order to treat the whole person, you have to understand the whole person. And that doesn't just stop with what they present to you when they walk into your office. You have to, that's a starting point, but that's only the tip of the iceberg. There's so much more to that patient or to that client. So, in order to, effectively treat or provide an effective treatment protocol for that patient, then you want to know all you can about that person, diversity, you know what I mean? And so a lot of people, when they hear cultural competence, they think first race. But there are so many other components that are kind of entangled in that whole cultural competency piece. So it doesn't just stop at race. It's so much more. It's socioeconomic background. It's gender, it's sexual or gender identification, so to speak, sexual orientation. There's so much that entails or goes into the definition of cultural competency. So understanding the whole person is integral in part to developing an effective treatment protocol to treat that patient in the first place.
Okay. Now you just schooled me because I was thinking pretty limited in my thinking. I was thinking race. So let's dive in. Let's dive in. So tell us more. You said it includes all of those things,
All of those things.
but you can't. So how do you become I guess well versed
Mhm.
such that you can, as a counselor, as a therapist, um, treat your clients that may come from, these diverse backgrounds.
Mhm. Well, I think I have to kind of back up a little bit because
Okay.
before you get to a place where you begin to learn all those things, the patient first has to come into your door,
Okay.
right? And so there are questions that have to be asked. And so a lot of the problems that I have run into personally in the past is stopping right there when the patient comes in, just treating the presenting problem. But there's so much more that helps you understand how that patient got there in the first place. So being able to ask those in-depth questions about that patient's background and not forming any biases based on what you see. And the best example I could give of that would be if a African American male walks into your office and you begin therapy with that person, you don't ask any questions about their background, their history, what their values are, their belief systems, their family, where they come from, and how can you effectively assign any type of diagnoses or treatment for that patient without getting that information. It's impossible, I think, in my opinion, it's impossible to know everything about every culture. You'll never know that. But all you can do is ask. It starts with a conversation. And that's a conversation that I found that's not being had. A
Okay.
lot of steps are being missed. So I think for sure it just starts by talking to your client, to your patient, finding out the bare necessities, if you will. Talk to them about, tell me a little bit about where you come from. How does, your family upbringing influence your decision making today? Because that's a big portion of it too. If a person from a different socioeconomic status than my own comes into my office, I can't adequately treat them from where I am. You have to, and you hear this a lot in therapy, meet the patient where they are.
Mm-hmm.
And I
Okay.
think that's the gist of how it begins.
Right. So I'm a pause right here and get the audience involved, the viewers. So how important do you all think cultural competency is? Or let me rephrase that. Do you believe that cultural competency is important when it comes to counseling? Give me a thumbs up if you think so, a thumbs down if you don't, or maybe mm, a shoulder shrug if you don't know. If it doesn't seem like a big deal to you at all, let me know in the comments. We want to hear from you.
Mhm.
So, I've been limited probably in my thinking about this topic, and particularly as it relates to race. Because I think that sometimes maybe we may have to spend time for a counselor or a therapist that isn't culturally competent. We may have to spend time explaining what it's like, and I'm going to use the race piece for example, what it's like to be Black in America, right? And some of those experiences that a white counselor or a non-Black counselor might not be able to relate to,
Mm-hmm.
right? So you spend more time in the session, like helping them to understand,
Mm-hmm.
like it's not something that you're making up. Like this is a
Mm-hmm.
real, these are real traumatic experiences, from microaggressions to bias to prejudice to discrimination, all of that.
Mm-hmm. Mm-hmm. And I don't think that you're alone in that. I think a lot of people have that limited understanding. And then, two, I don't think that it's necessarily a bad thing having to spend time getting to know your therapist or helping your therapist get to know you. Because again, you're doing a disservice to the patient if you just assume, for instance, let's go back to your example, the race thing. I'm doing a disservice to my patient if I assume that a Black woman, let's just say you, Nicole, and you're sitting in front of me, and I assume that because you're Black, I'm Black, that I know what you're going through.
Mm.
That's unfair. I can't make that. Again, I'm allowing my biases that I have about myself as a Black woman to now kind of, what's the word I was looking for? I'm projecting. There it is. I'm
Mhm.
projecting my own biases onto you. I don't know anything about you or what your struggle has been or lack thereof struggle. So I have to ask those questions, and sometimes you do have to give me more insight into who you are so that I can better serve you. Now, there are instances where I'll go back to the same example you gave, Nicole. You're working with a non-Black therapist. And
Mhm.
that has been the reason for a lot of clients that I've seen who've come to me. They'll say, I had a therapist, but I had to leave them because they just didn't understand me. Right? I spent too much time helping them understand what I was going through, or I felt bad sharing my true struggle with them because they didn't understand. And I think
Mhm.
that we spoke partly about this a little while ago. Whenever the client or the patient starts to feel bad for the therapist, then what are you doing? Because now their feelings are being, you know what I mean, that there's that transference, there's another therapy word, there's
Mhm.
that transference that gets in the way of me being able to provide you adequate care.
Right.
So again, it just kind of whether you decide to see a therapist that looks like you, which is always going to be something that's great because you begin to build that relationship based off of shared experiences in
Mhm.
most cases. But if
Most
even if a person were to decide to see a therapist that doesn't look like them, it is that therapist's responsibility to educate themselves and to make sure that they are pretty much, lack of better words, but bone up on your terminology, like learn, study, educate yourself on your patient so you can give them what they need.
Okay. Great point. So Ozzy said it is fully, if you don't have cultural intelligence, it could go sideways real quick. It's about learning that individuals in their totality then address the situation.
Mm-hmm.
Hmm.
Mm-hmm. I agree with Ozzy 1000%.
Okay, good deal, good deal. So, but that takes time, right?
It does.
So, what is there like a checklist that you recommend that maybe counselors have to, kind of, you know, dig a little deeper? Like I've had people talk to me about their apprehension in going to counseling because they feel like maybe they can't really be themselves. Right. Like
Mhm.
almost like they're trying to protect the counselor from them. Like they're
Yeah.
just so messed up that,
Mm-hmm.
the counselor wouldn't even be able to handle them at all. And
Mm-hmm.
so I am, and my whole point to them is like, no, that's why you go to the counselor, because they're able to take all of that. You know what I'm saying? They're not taking it personal. You expressing yourself about your experiences, they're there to listen and help you talk through those things.
Mm-hmm.
Right.
Right, right. So to answer your first question about there being a checklist, I can't say that I have a checklist.
Okay.
I think that the initial appointments, when I have a client come in to see me, there's that whole information gathering phase. I let them know early on when they come that that's what you can expect in a first session. It's going to be a lot of talking about history. I'm going to be gathering a lot of information because this helps me form a case. much like you would if you were going to see a lawyer. They're going to gather a whole lot of information in order to build their case, to help you win said case. So again, I don't necessarily use a checklist in my initial first time meeting a patient or a client. I gather a lot of history information, and then it's throughout the course of our work together that I'm learning more and more about that patient. The treatment evolves over the course of time. And yes, you're right, that does take time. Therapy takes time. It's not, I'm going to go in, I'm going to do this for 2 weeks and I'm done, because I can't fully understand you and where you're coming from and help you sort through your issues in a short period of time. I mean, unless, you come in with very specific issues, and then I do use what's called short-term or solution-focused type treatment modality, but that's very far and few in between, because the patients I treat come in with historical information. They come in with histories of trauma. They've been dealing with over the period of their lifetime. That's not a short and sweet resolve. That takes time.
It does. So the encouragement there is to be patient.
Definitely. You want to be patient. But all of that, I say all of that to say that, first of all, you've got to have a connection with the client in order to get them to stay. If I come into a session and I feel like I spend 90% of the session every week trying to get you to understand where I'm coming from, trying to get you to understand my values and what it looks like to be me, to walk in my shoes, then the likelihood of me completing that treatment goes way down. You know what I mean? So you have to ask questions, and that's where it falls again. It falls on the professional. It falls on the clinician, the physician, the psychiatrist, whomever is treating that patient. It falls on you to ask the right questions early on, so that if you can help that client, you do. But if you can't, and you can't figure out a way to bridge that gap, then you have to either A, be comfortable enough to ask those hard questions, or B, you have to be wise enough to say, hey, I find that this might not be the best setting for you. Perhaps let's do some research and find someone else that could better serve your needs.
Indeed. Great point. I want to bring up Lynette's comment. She said, I'm glad you made the point. Just because someone looks like you doesn't mean they have a shared experience. I'm a neurodivergent. Not all neurodivergents share the same experience or require the same accommodations or needs. To assume is indication that that individual needs to work on their cultural intelligence. So, great point.
That is a great point.
So let me ask you this: how important is language?
The language that we use. I think language is severely important to some degree. I mean, to most points that we've made here tonight so far, is that, I think we talked about this a little while ago too, Nicole. I don't think necessarily that a therapist should change how they speak in efforts to better bond with a client, because in doing so, you're not being true to yourself. You're not being authentic. And then a client can see right through that. And, a client's not going to want to work with a therapist that's not being authentic, and then in the same breath is preaching or expecting their client to be authentically themselves. So I think that the best thing you could do, again, as a therapist, as a physician, clinician, is to present yourself in an authentic manner. I have never once told a client that, they come in, I have clients who curse. I don't necessarily curse during the session, but hey, listen, when they talk and they're being themselves, I encourage that, because that's the side of you that I need to see, that I want to see. I encourage you to be that. I don't necessarily think that, like I said, again, language is important in the fact that you want to make sure that you are speaking from areas of expertise, that you're familiar with. Language in that way is really important, but the language that you use between your, client and therapist, I think it should just be authentic. And what's the word you use all the time? Organic.
Yes, very organic. For sure. So it sounds as if too, that the clinician has to have a certain level of self-awareness as well.
Absolutely. You have to be aware of yourself. And part of some of the research that I was telling you about that I was doing is called Know Thyself. You have to be aware of who you are. You have to know yourself inside and out. You have to be aware of your own biases, because in thinking that your own biases do not impact the relationship between you and your client, you're already doing a disservice between, to your client. So you have to, the more you know about yourself and the more self-aware that you are, the better suited you are at with helping and, a patient or a client work through their stuff.
Absolutely. So Chastity said healing can be messy. It's not an easy process. So I totally agree.
Mm-hmm.
Yes, 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 yes. So let's talk around culturally and linguistically appropriate interventions
Mm-hmm.
and services. What's your recommendation on that?
That's a mouthful.
It is.
It is. That's a big one for me, Nicole, because so not only, we talked tonight about, cultural competency, just being aware of you're treating the whole person, right?
Mhm.
But when it comes down to treatment recommendations, when that's that linguistic piece, you want to make sure that you're providing services, therapy, what have you, in a language that's preferred by the client, by the patient.
Mhm.
You know what I mean? So one of the biggest examples that keeps coming up over the course of my life, because I've been doing this for a long time now. And I remember a long time ago, I had 4 um, deaf, deaf,
Mhm.
nonverbal clients. And the agency, whom I shall not name, they did not provide me adequate resources so that I could better serve that population. It was 4. And I was not trained in sign language. And so what I ended up having to do was go out into my community and pay for myself training classes to become, ASL certified so that I could better serve my clients to make sure they were getting what they needed. So when it comes to that linguistic and culturally incompetent cultural intelligence piece, that linguistic piece is just as important because, again, services have to be readily available to a patient, to a client in a language that they prefer.
Wow. That's, you talk about going the extra mile.
Yeah.
I mean, I guess, I mean, you could have maybe referred them on to someone that, was ASL certified.
I could have, however, but the state resources were very limited at
And
that time, if you know what I mean.
I
And
got it.
so I had to do my due diligence because, again, we're talking about a system, and I'm gonna go there just for a tiny second. I'm gonna go to the race piece again.
Okay.
But we're talking about a system where these were Black men who were nonverbal, or they were, ASL using or ASL speaking individuals. And so therefore their services declined because there was no one to serve them. So if not me, then who? So I had to do my part and go out into the community and make sure that I trained myself up enough to get enough learning, of the ASL language so that I could serve them and get them what they needed. In order to communicate what their needs were, someone has to be able to communicate. So if
Yep.
not me, then who? Who was going to go out that extra mile for them?
I mean, very good point. Very, very, very good point. So what are some other, how does cultural, I guess, incompetency show up in counseling?
Mm, you would be surprised. And
Surprise me.
I
Surprise
will
me.
say that for me, it's 2022, and just lack of, well, I just didn't know is no longer, an acceptable excuse because there's so much research out there. There's so much public knowledge out there for people to educate themselves, even if the companies or corporations or agencies that you work for do not provide it. So, just saying I did not know better is no longer a valid excuse, in my opinion. So cultural incompetency shows up. I have to give examples. So there was an instance where I was working, and again, this was a long time ago. I was working in an agency where a patient came in, and she was a woman, obviously. She was a woman who had gone through domestic violence, but she did not disclose that domestic violence right away. She just came in looking the way that she was looking and having, the baggage that she had with her and her children with her. Everyone assumed that she was homeless, and everyone assumed that she was med seeking because of the way she presented day one of her appointment. But no one took the time to do further investigation and collect more information from this woman to further learn that she had been displaced due to domestic violence. And so therefore, when her initial treatment protocol was written up, it did not take into account what her needs would be based on domestic violence. They wrote her off as simply that, oh, she's med seeking, she's probably homeless, she's a druggie, so we're just gonna, give her some referrals and send her on her way. When in actuality, they could have done more to serve that patient. They could have provided her better resources so she could have gotten the help she needed right then and there, versus her having to go out, jump through the hurdles that they put her through. Then she come back to say those things didn't work for me. What else she got? So right then and there, that was a good example of where your lack of cultural competency failed this patient. So just being able, again, you judge that woman based on how she presented day one when she got there.
Right. So perception became their reality.
Exactly.
Which we often do, right? We make judgments, we make assumptions about people without having those conversations.
Right. And so you can see just from that example how important it is to, like I said, to ask those questions, ask the hard questions, because again, we talked a little while ago too, how uncomfortable some of these conversations might make you, but they're conversations that need to happen.
Yeah. So what advice would you have for, in terms of having those tough conversations, asking those hard questions, what advice would you have for counselors as it relates to that?
I think that every counselor, therapist, they have their own style, you know what I mean? And as long as you are being as true and authentic of yourself to that patient, those hard questions, yeah, they'll be hard, but it's a lot easier to ask the hard questions when you're being honest and open. If you don't know something, don't present yourself as if you do. Don't make assumptions. If you don't know, ask. That's like the best thing you can do for any patient. Just ask them, well, what do you want? What are your needs? How does your, like I said earlier, how does your family values impact your decision making? If a person comes to you and says, well, I'm having a hardship in my relationship, in my marriage, these things are happening to me. And a therapist says, well, leave that marriage. Well, what you don't understand is that in my culture, that's not allowed. I can't just walk out on my marriage. You know what I mean? So it's just like, you got your own style. Just be true and be authentic, and just ask the hard questions. And if you have developed a good relationship with your client, as you should, that rapport is there, then those questions should come naturally to you, in my opinion.
Okay. Folks are chiming in about that example that you gave. You said that was prejudice that led to discrimination. That hurts my heart when the system fails. And Rashonda, who's right here in Tallahassee, thanks for being on. She said, wow, judgment, assumptions, they should lead to conversation to understand and help. Yes. So, wow, I'm trying to think of where to go from here, because I have thoughts around, like digging deeper, right? Because sometimes I believe in therapy. People, well, I'm going to go back to the race one, right? So, with the persons that I've talked to recently about going to therapy, I feel like they have expressed their inability to be themselves because maybe they thought they couldn't be, like they couldn't curse, or that they would have to code switch. And we've talked about code switching, you and I have, from the standpoint of being one way with Black folks and being another way with white folks, right? So you use the King's English when you're around, white people, and maybe you use, I'll just call it slang or ebonics or however you want to call it, when you are around Black folks. And so again, to me, that gets into the whole linguistic piece, right? Because maybe your white therapist wouldn't know what you were talking about based on some of the terminology and the words that you would use. So I just, again, the whole comfortability piece and being able to be comfortable with your therapist is paramount, right?
Yeah, I agree with that. That's a really big piece of the puzzle. And again, it goes back to what I said, meeting your client or patient where they are. If why would I use every word in the dictionary when talking with someone who might not, speak that way. I might want to meet them where they are by getting on their level. I mentioned to you earlier before the show began how when I worked in substance abuse, my population I worked with were teenage boys. I mean, that just speaks for itself. I mean, the things that they would say, but the way that I communicated with them, the way that I got them to trust me, it was by getting on their level. I listened to the music they listened to so I could better understand where they were coming from. I mean, again, being Black does not necessarily equate to understanding. So they would say things and talk about things that were way over my head. I couldn't understand. But just meeting them where they were and just making attempts to get on their level and asking those questions. You know what I mean? Code switching is a big one. We see that all the time, especially in private practice, where I might be, and I will use myself as an example, when I'm with my colleagues, I might behave or I might speak a certain way, and people might call that professional. But then when I have, a Black woman, a girlfriend of mine who would come into the office, people would hear me speaking differently and they'll say, "Hey, I noticed you were talking to so-and-so and you were having a good time. You don't act like that around here." It's like, I'm familiar. That's called familiarity. So you might get that patient that that client that you do develop such a rapport with, that those walls do break down. And you will find yourself, and you call it code switching, you'll find yourself again meeting that client where they are. But that comes over time. That comes with rapport building, I think.
For sure, for sure, for sure. So other folks chiming in. So Isis is in Little Rock, Arkansas. She's a clinician as well. She said cultural competency is crucial. City and treatment teams taught me a lot. Okay, cool. All right. So again, folks are chiming in. Rashonda said that open doors for conversation that would otherwise be a closed door. So yeah, I think again, just the openness and the willingness um to understand your clients and really serve them, right? Really
Right.
serve them.
Mhm.
So talk to me around some other examples outside of race, outside of the I mean the one that you gave was really excellent, but give me some other examples that maybe we might overlook
Mhm.
because because of our own bias or prejudice or what have you.
Um, well, I don't know if this was something that was necessarily overlooked on my part, but I find myself in a position right now where I have several clients of mine that are have an Asian background,
Mm,
something of which I know nothing.
mhm,
And so, it didn't mean that necessarily I turned them away when they, came to me looking for help. It just meant that, hey, you're going to have to do your homework here because this is not an area that you are completely familiar with. And all those things that I was not familiar with, I asked. I asked questions. We talked a lot about some of the challenges that they were facing as it related to relationships. And in their culture, well, this particular young woman's culture, it did not permit her to live with her fiance at the time. She couldn't live with him until she was married. She had to remain in the home with her mother and father until she became a bride. But she was talking about a lot of the challenges that she faced. Now, in Western culture, it is largely acceptable for the woman to live with her partner or boyfriend or what have you. And parents, while they might disagree, it's not something that would have them shunned from their family forever. Whereas in her culture, that was not necessarily something that was an option for her. So for me to go into our sessions and continue to encourage her to leave the home, I had to understand from a cultural aspect that wasn't an option. So then we had to explore other options on teaching her how to cope and how to communicate and establish boundaries within her household with her mom and dad.
Wow. Very interesting. So it's almost like, in some regards, I mean, with that example, as well as with the boys that you mentioned, you have to kind of become a bit culturally proficient,
Mhm.
right? Mm-hmm.
And that's what cultural competency is
Mm-hmm.
building your proficiency. That's exactly right.
Mm-hmm. Mm-hmm. So Lynette had a comment that I think is worth sharing. She said, going back to the four deaf clients, speaking of cultural intelligence, last year I learned that there is Black American Sign Language, BASL. I wonder if those that use BASL feel they must code switch to ASL. BASL could be a preferred language.
Mm-hmm.
Yeah.
She's absolutely right, because you're going back to that linguistic piece. And I said you have to be willing to provide services in a language that is preferred by the client. So she's absolutely 100% correct. That BASL is definitely, if that is their preferred language of choice, you have to be willing to meet them there if you are trained in that skill set.
Yeah, no, that's a great point. And I actually learned about that, I think on it was either Sunday Morning or 60 Minutes or one of those CBS magazine shows. And I was quite blown away by it. I was very fascinated by that. I didn't
Mhm.
know there was a Black American Sign Language. So
Yeah, I'm fairly new to that one myself.
yeah, pretty interesting. So we talked around, and I'm big on takeaways. So we talked about the clinician in particular being authentic, their willingness to ask those hard questions and have those tough conversations. Um, Anything else that we can, in terms of like a takeaway or things that the clinicians in particular can do to be more culturally competent?
Mhm. Well, I would say, and I shared this too. I'm also a clinical supervisor, so I train,
Mhm.
therapists who are seeking licensure. And one of the things that I always put out to them during some of our, monthly trainings is that, never stop being a seeker of knowledge. Because again, like I said, it's impossible to know all things about every culture and every population, but that doesn't mean that you have to stop educating yourself. Because as you can see, even with, living in this pandemic, how much things have changed, how people have chosen to communicate. People are communicating a lot more via text. Text messaging is now a part of the therapeutic services that we can now provide in the state of Florida. We are now allowed to communicate via text with our patients if that is their choice, right? If that is their preferred method of treatment, right? So you have that, you have telehealth. So again, I say, just never stop being a seeker of information. Always, educate yourself, read up on it as much as you can. Also confer with colleagues, because you'll be surprised, just sharing experiences across the board. I know one listener mentioned how much she learned in treatment teams. That's a wonderful place to share new information and to gain insight. So, just educate yourself.
Great points, great points, great points. Okay, Rashonda said cultural competency should encourage professionals to research, study, and learn cultural differences to meet clients where they're at, but it definitely helps to nurture a safe net for your clients. Okay, so doing your research, becoming a proficient,
Mhm,
right?
mhm,
Not that you're necessarily going to be an expert, but at least to be relatable,
mhm.
right?
Yeah,
Mhm.
know enough. You have to know enough about what you're working with, and then also know enough to know your boundaries,
Mhm.
right? Because people assume that the clinician, the therapist doesn't have boundaries, and they do.
Mhm.
In this day and age, you've got, we talked about what cultural competency includes, and we talked about how there's the race, the gender, the sexual orientation, blase, blase, with the everything that's going on in the LGBTQ. I don't know all the letters, and I'm sorry. But with all the things that are going on in that particular community, the LGBTQ, as far as I know, but all the change that are going on in that community, if that is a population or community that you're not knowledgeable of, if that is a population that is not your preference and you choose not to work with that population, that too is okay. You have a right to say, well, that's not my preference. I don't work with that population. So knowing enough about yourself to know your limitations, because again, the last thing you want to do is put yourself in a situation and you're pretty much going against your own values and beliefs. Again, your values, your beliefs formulate your biases. So your biases do impact the type of care that you provide. So again, just being mindful and being aware, if this is not something that aligns with your own values and it causes you to formulate biases on a particular population, then that would be a population that you need not work with.
Balance, yes. So let me ask you this, because this came up when I met with our local 211 um, staff, and they are the clearinghouse for clinicians, licensed clinicians in the area, right? And they told me that, so they have a spreadsheet that um, shows a number of different populations. So, you know, they can say, I work with, LGBT, I work with um, women or adolescents or geriatric or what have you, right? So on this spreadsheet, they allow the clinicians to choose whatever populations that they deal with, right? Well, you have some clinicians that will select everything, and they're like maybe 30 different populations to choose from. That was a red flag for me because I just don't feel like a clinician could be everything to everybody.
Right.
So, what's your thought on that?
I mean, right away, my first mind tells me that this is probably a clinician that chooses everything, is a clinician that has not yet figured out her niche.
Mm,
And maybe they're still on the path of figuring that out. And so, in doing so, they want to try to work with as many different populations as they can until they figure it out. I
mm,
mean, that's not, I mean, it's a sign of a novice therapist, someone who is very, fairly new and has not, like I said, been around long enough to know exactly what their specialties are. Maybe they're not certified in any one thing.
mm,
You know what I mean? And so it's not necessarily a bad thing, but I can see how that would be a red flag, Nicole. But again, my mind tells me that this is someone that's probably trying to figure it out, to figure out what their niche is and what their strong suits are.
okay. Well, I don't want them trying to figure it out on me. Like,
Right?
I want them to figure out what it is that they specialize in, or
Mhm.
which populations that they want to serve, and let's go with
Mhm.
that. Okay.
Mhm. Absolutely.
Yeah, because I think that again, I don't think that there's any one therapist that can be everything to all cultures. You know what I'm saying?
I agree.
Um, yeah, yeah, in all populations, and there are a wide variety of them. You know.
Mhm.
Mhm.
Right. And again, that's what it's going to be very important for the practicing professional to know your lane and quote unquote stay in it.
Mhm.
Just know where you fit in and stay with that, because you do your best work when you're practicing in an area where you are knowledgeable versus, when you're not, when you're just kind of floating out there, just letting everything happen to you versus you happening or impressing upon the client. Thank you.
Mhm.
LGBTQIA.
Yes, thank you, Lynette. And bingo to that last point in terms of you want to be with the clinician who is um, that can stay in their lane and do well in the areas that they are versed in, and you know, yeah, yeah. I'm gonna just leave it there. All right. So, is there anything else you would have us know? And I also to the audience, if you all have any questions, by all means, please put them in the chat so that we can address them. But anything else that you have us know? Because again, I think the takeaways have been really good. Ask the hard questions, be authentic, do your research, and confer with colleagues. Those are like the four kind of main points that I've gotten thus far.
Mhm. Yeah, I agree. Those are my takeaways,
Yeah.
man.
Okay.
Like, again, I'm staying in my lane. I don't want to give too much because I am one thing right now.
Indeed, indeed, indeed. For sure. No, we want you to do that for sure, for sure. Um, have you? I guess is cultural competency something that I guess in the profession that you see, um, either training as it relates to that, or talks, or something that in terms of like either continue education or something or another like that. Do you see something like that in the field at all?
For me,
Mm-hmm. Like
um,
most counselors and therapists, is that something that
oh
comes
yes,
up?
yes.
Yeah.
Yeah,
Okay.
it comes up all the time. There's all kinds of continuing education, credits that a therapist can take, and I don't think they offer necessarily. Well, yeah, they do. I've come across several cultural competency, like um, not certifications, but what do you call them? Like we have to get them for license. It's kind of like a CEUs, I guess.
Yeah. Continue education.
Yeah.
Mhm.
So, yeah, there's plenty of classes out there for you to take, and a lot of get with your agency. If you work with an agency, if you're not private practice, they offer
Mhm.
lots of cultural competency courses and training. But again, if you don't ask, they don't disclose it unless it's something on their docket to discuss. Hey, this is an issue that's been brought up. Now we're going to push for all these cultural competency trainings.
Mhm.
So if they don't readily have it advertised, definitely ask, because it's available to you.
Right. The other thing that I have noticed, since 2020 and all of the social unrest, racial unrest, is that now it seems like all of the corporations have these DII um, divisions and teams and
Hmm.
so on and so forth. So, and DEI rather, which is diversity, equity, and inclusion.
Hmm.
So, what's your thoughts on that?
Mm, well, I have a very personal experience with that. I was actually a part of a cultural diversity and inclusion team, if you will, that dispersed because there was just so much bias in that team, or whoever um, started the whole thing. It was just too much was going on, and they ended up breaking apart, and then they put it back together again once they cleared house or whatnot. But my thoughts on that is that yes, it's necessary, but I felt very much like it was a slap in the face because it's something that we have been asking for and rallying for so long. And by we, I mean clinicians and therapists alike. We have been asking and saying that there needs to be more inclusion, there needs to be more cultural diversity just across the board. And then it took for something horrific to happen. I don't know about anyone else, but my experience came immediately following the George Floyd incident. And then all of a sudden, there were all of these trainings and all of these board members wanting me to join the team. And then what I didn't like about it was that I was expected to be the resident Black woman. And I could not, I couldn't sign up for anything like that because I cannot be the spokesperson for all things Black. Whenever there was an issue, instead of them having conversations around that with the population of people that were impacted, they would come to me and say, hey, what do you think everyone is feeling about this? And I just kind of like, I was like, no, that it just was inappropriate to a large degree. And so I just said, no, I don't want to be a part of anything like this. I want to be a part of conversations that are happening more organically, that are happening because not only because there is a need, but because there's a desire to know, and not because it's just a platform made up of Black women. I can't be a part of that.
Good point. I think a lot of us may have felt some of that. And I didn't specifically mention George Floyd, but absolutely we saw an increase in those types of activities after the death of George Floyd. So yeah, thank you for sharing that. Ashley Renee had a comment. She said, in most graduate programs, their cultural competency leaves much to be desired. So CEUs are crucial. Even C-CREP programs that are supposed to integrate cultural competency lack in this area.
Mhm.
All right. And she also followed up and said it's because many of those diversity trainings don't realize that Black people are not a monolith. Yes. And one of us cannot speak for the whole. Indeed, Ashley. Indeed.
Yes, that's a major point she just made there, because that's
Mhm.
exactly right on point. We are not one and the same, and she's right, a lot of those cultural diversity trainings and platforms from where I was sitting at the time, um, it was presumed that one could speak for the whole. And
Mhm.
that's just not the case, because again, I said earlier, just being Black does not equate to shared experience. There's so much more.
Right, 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 right. Because of different socioeconomic or
Cultural
religious or
beliefs,
yeah.
religion, values. Everybody
Mhm.
Black didn't come from the same religious upbringing. Everybody Black
Right.
doesn't have the same shared values.
Mhm.
Everyone is different. And so just taking that, and that is my final takeaway, taking that into consideration, everyone is different. As
Mhm.
long as you have a willingness and a desire to know who you're working with, to know your patient or your client, you can go far. You can help that client.
Okay. All right. Good deal. Good deal. Good stuff. All right. Well, we are coming to our wrap up time, but I wanted to give you an opportunity to share any last words or comments.
Last words or comments. I am accepting clients. I am accepting new clients, and anyone who is looking to find me can email me at Satara Carr at blisscp.com, or you can look me up. My web address is blisscp.com.
All right, I'm gonna get you to say that for me one more again so I can put it in the comments. I should have had that ready tonight. So, tell me the email again.
My email address is Satara Carr at blisscp.com.
Right. Yeah,
And then the website is blisscp.com.
gotcha.
CP stands for counseling practice and not colored people.
I like that sense of humor there. Okay. Is that it?
That's it.
All right, good deal. So you all please reach out to Satara. All right, Miss T said just being black does not equate to having the same experience. Is so true. So she also agrees. All right, very good, very good. So do you have a particular specialty or area that you work in your practice?
Mhm. I specialize in anxiety, depression, and trauma.
Okay.
That is what I'm certified and trained in.
Okay. All right. So she see it. There's anxiety, depression, and trauma. She got three things that she does. Period.
Period.
Okay. Love it. Love it. Love it. Well, anybody else, any of the viewers have any questions, any comments? I hope this was helpful. Let us know. Cultural competency does not just apply to race. And for the clinicians out there, the takeaways are asking the hard questions, being your authentic self, doing your research, as well as conferring with your colleagues and realizing and keeping in mind that everyone is different. All your clients are different, even though they may have maybe the same racial makeup or cultural from the standpoint of being from a particular place or practicing a particular religion or being of a certain sexual orientation. Everybody is different. Okay. All right. Ozzy commented and said, awesome show tonight. Very informative. Thanks, Satara. Welcome to the gap between the T family.
Wow, thank you. It's nice to be welcomed.
Yeah, Ozzy is our special friend.
Thank you,
Ozzy
Ozzy.
is from St. Thomas, actually.
Oh, okay.
So yeah. All right. And my sister friend Maya, thank you for being on here, Maya and Rashonda. All right, so folks are chiming in. Cool. Appreciate that. Now you have done some other work that I think is definitely noteworthy and definitely want to have you come back and talk around some of that. We talked about you did some work with substance abuse. Yes.
Yes, 7 years substance abuse. Yes, I also did. I worked in eating disorders for a short period of time. Very informative, very educational for me. I worked in it long enough to realize that that was not my strong suit.
Okay.
I learned a whole lot while there, and I'm very appreciative of that. But yeah, I've worked in work disabilities. I've worked with the geriatric population as well.
Okay.
So yeah, I've just kind of been around a little bit, just again trying to find my niche.
Yes. Yes.
I
Yes.
found it.
Okay. Good. 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 So what'd you say? Tell me what your three things are.
Trauma, anxiety, and depression.
Okay. Trauma, anxiety, and depression. So if folks want to receive some counseling as it relates to that, hit Satara up. Okay, Ozzy just told me St. Croix. All right, my bad, Ozzy. St. Croix. All right, so Satara, your information is out there, and folks can connect. I believe that they have ample opportunity to connect with you. Chastity said, "Great information. Definitely see your passion at heart." Oh, nice.
Thank
All
you.
right, and who is this?
That's my husband.
Oh. Oh, hubby. Okay. Hey, hubby. He said, I believe you also have 20 years of experience of dealing with crazy. He telling on himself, huh?
On himself, not on me.
Love it, love it, love it. Well, for those of you who are new to Conversations with Nicole, I definitely invite you to subscribe to the Conversations with Nicole YouTube channel. Subscribing and supporting, and we need all the support we can get. I've been trying to up my views to 4,000 viewing hours is what I'm shooting for. But I thank you all for tuning in tonight. Thank you for your comments. We really appreciate the engagement. Uh, Ashley said, very necessary conversation tonight. Cultural competency is needed in a field where social advocacy is a major part of what we do. Absolutely.
Absolutely.
Yes, yes. Thank you, Ashley, for sharing that. All right. And thank you, Lynette. All right. Rashonda said trauma, anxiety, and depression. Yes, 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 yes. All right. So, you all, please, let's keep this conversation going. Please get your checkup from the neck up. Connect with a counselor, a therapist that you are comfortable with and that will serve you well. That will serve you well. We are encouraging that. We want to be well in our community, and you gotta, if you, there is no health without mental health. So get your mind right. Get your
Yes,
mind
ma'am.
right. Yes, yes,
Yes,
yes.
ma'am.
Thank you again, Satara.
Yes.
And we'll see you in the future. Y'all
All
check
right.
me out. Yes, appreciate it. Check us out on Wednesday. We actually will be talking music and mental health with international gospel artist Glacia Robinson, who will be coming to Tallahassee very soon. So you don't want to miss that show. All right, good people. We will see y'all next time.